Hello, I'm Dr. Rafi Romano. Today I'd like to show you a very complex case, both aesthetically and functionally and occlusally, of an adult patient that was treated with clear aligner. The advantage of the clear aligner is that we can plan with CAD/CAM software, we can plan all the movement in a very accurate way. But not only that, in adult patient, we can cover the teeth which has periodontal involvement and very small bone support. We can cover them three-dimensionally. The clear aligner cover them from buccal, from lingual, from the sides. So we avoid the jiggling that we have sometimes with brackets. And also we provide the patient with an option to take the aligner off, to clean properly, to eat properly, and not to have all the remnants around the brackets. So you can see here the case, if you are a dentist, you can really appreciate the difficulties in such a case. We have two planes of occlusion, we have crowding in the lower arch, we have very big space in the upper arch, and we have a very, very deep traumatic deep bite that the lower incisors touch the palate and give trauma to these front teeth that all the time move forward and get spaced. So the planning for this case was done by the software that we have with Invisalign, which is the Clean Check. So we can plan not only the final result, we can plan, and this is very important, you have to understand that planning a treatment with the CAD/CAM software doesn't mean to rely on the company's recommendation. You have to put your own philosophy of how teeth move, in what stage we move what teeth. So this treatment was planned on a long term for a year and a half, and not doing anything rapidly, doing very carefully, consulting with the periodontist to see that we are not applying too much force on these teeth. And you can see here the patient slowly wearing these clear aligners. You can see how we progress. You see the attachments he has on the teeth, which help to give retention to the appliance to the teeth. And you can see slowly we are opening the bite both by extrusion in the posterior teeth and intrusion in the anterior teeth. And slowly we are leveling the two planes of occlusion. Everything is done stage by stage without rushing. Every time control of oral hygiene, periodontist. You can see here how we progress. We had big crowding in the lower arch, still in treatment. Here you can see after around a year, the teeth are now open. We have midline, the diastema is almost closed, the papilla is growing slowly, which is not obvious. This will happen only if you keep the parallelism of the root, if the oral hygiene is really good, if the biology is preserved. And you can see here the shape of the arch, both upper and lower, and you can see how the profile looks, what kind of appearance we gave to this patient, who is an adult patient, almost lost faith in getting a very nice aligned teeth. And most of the prosthodontists are lost in such a case because they cannot do restoration without correcting the bite. Here you can see the remnant of the impression that we took for refinement aligners for this case, which need a little movement just to finish the case more properly, but already the arches look almost finished. and very, very nicely aligned. Here is before and here is today, which is a dramatic change for us as doctors and for him as patient. Thank you very much, and I would love to see you in my next series of videos. Bye-bye.